ನಮಸ್ಕಾರ. ಇಂದಿನ ನಿಮ್ಮಲ್ಲಿಗೆ ಕನ್ನಡ ಕೂಟ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಎಲ್ಲರಿಗೂ ಸ್ವಾಗತ. ಇಂದು ಆರೋಗ್ಯ, ಮಧುಮೇಹ ಇದ್ರ ಬಗ್ಗೆ ಆಯುರ್ವೇದದಲ್ಲಿ ಏನೇನು ತಂತ್ರಗಾರಿಕೆ ಮತ್ತು ಪರಿಹಾರ ಇದೆ ಅಂತ ನಮಗೆ ತಿಳಿಸ್ಕೊಡಲಿದ್ದಾರೆ ಡಾಕ್ಟರ್ ಲಲಿತಾ ಬಿ ಆರ್. ಇವರು ಅಮೆರಿಕ ಪ್ರವಾಸ ಮಾಡ್ತಿದ್ದಾರೆ. ಅವ್ರ ಮಗಳ ಮನೆಗೆ ಬಂದಿದ್ದಾರೆ. ಸಮಯ ಮಾಡಿಕೊಂಡು ನಮ್ಮ ಜೊತೆ ಅವರ ವಿಷಯಗಳನ್ನೆಲ್ಲ ನಮಗೆ ಕೊಡ್ತಾ ಇದ್ದಾರೆ, ನಮ್ಮ ಜೊತೆ ಶೇರ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಅವರಿಗೆ ನಮ್ಮ ಕರ್ನಾಟಕ ಸಂಸ್ಕೃತ ಸಂಘ ದಕ್ಷಿಣ ಕ್ಯಾಲಿಫೋರ್ನಿಯಾ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕವಾದ ಸ್ವಾಗತ ಮತ್ತು ಧನ್ಯವಾದಗಳು. ಇವರನ್ನ ಪರಿಚಯಿಸಲಿಕ್ಕೆ ನಮಗೆ ಈ ಕಾರ್ಯಕ್ರಮ ನಡೆಸ್ಕೊಡ್ಲಿಕ್ಕೆ ಸಹಾಯ ಮಾಡಿದಂಥ ನಾಗೇಶ್ ಮತ್ತು ಗೀತಾ ಮತ್ತು ಭಾರತಿ ರವಿ ಅವರು ಕೂಡ ಧನ್ಯವಾದಗಳು ಮತ್ತು ಸ್ವಾಗತ. ಅವರು ನಾಗೇಶ್ ಅವರು ಮತ್ತು ಗೀತಾ ಅವರು ಪ್ಯಾನಲಿಸ್ಟ್ ಆಗಿ ಬಂದಿದ್ದಾರೆ. ಅದರ ಜೊತೆಗೆ ಧಾರಿಣಿ ದೀಕ್ಷಿತ್ ಮತ್ತು ಮಂಜುನಾಥ್ ಶರ್ಮಾ ಇದ್ದಾರೆ. ಅವರು ಕೂಡ ಹೃತ್ಪೂರ್ವಕವಾದ ಸ್ವಾಗತ. ಈಗ ಡಾಕ್ಟರ್ ಲಲಿತಾ ಅವ್ರನ್ನ ಪರಿಚಯ ಮಾಡಿ ಮತ್ತು ಕಾರ್ಯಕ್ರಮ ನಡೆಸಿಕೊಳ್ಳೋಕೆ ಮುಂಚೆ ಪ್ರಾರಂಭ ಮಾಡಲಿಕ್ಕೆ ಮುಂಚೆ ನಮ್ಮ ಸಂಘದ ಒಂದು ಪ್ರಕಟಣೆ ಇದೆ. ನಿಮಗೆಲ್ಲ ಗೊತ್ತಿರೋ ಹಾಗೆ ಫಾದರ್ಸ್ ಡೇ ಇನ್ನೇನು ಬರ್ತಾ ಇದೆ ಈ ಭಾನುವಾರ. ಸೊ ನಾವು ಮುಂದಿನ ವಾರ ಒಂದು ಕಾರ್ಯಕ್ರಮ ಇಟ್ಕೊಂಡಿದ್ದೀವಿ ಆನ್ಲೈನ್. ಸೊ ನೀವು ಡ್ಯಾನ್ಸ್ ವಿತ್ ಡ್ಯಾಡ್, ಸಿಂಗ್ ವಿತ್ ಡ್ಯಾಡ್, ಕುಕ್ ಫಾರ್ ಡ್ಯಾಡ್ ಯಾವುದೇ ರೀತಿ ಆ್ಯಕ್ಟಿವಿಟಿನ ಒಂದು ವಿಡಿಯೋ ಮಾಡಿ ನಮಗೆ ಕಳಿಸ್ಕೊಟ್ರೆ ಅದನ್ನು ಮುಂದಿನ ವಾರ ನಿಮ್ಮಲ್ಲಿಗೆ ಕನ್ನಡ ಕೋಟ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಪ್ರಸಾರ ಮಾಡ್ತೀವಿ. ಸೊ ಏನಾದ್ರು ಪ್ರಶ್ನೆಗಳಿದ್ದರೆ ರೂಪಾ ಸುಭಾಷ್ ಅವ್ರನ್ನ ಸಂಪರ್ಕ ಮಾಡಿ ಅಥವಾ ನಮ್ಮ ಯಾವುದೇ ನಿರ್ದೇಶಕರನ್ನ ಸಂಪರ್ಕ ಮಾಡಿ. ಸೊ ಎಲ್ಲ ಭಾಗವಹಿಸಿ ಮತ್ತು ನಮ್ಮ ಎಲ್ಲ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಭಾಗವಹಿಸಿ. ಈಗ ಕಾರ್ಯಕ್ರಮ ಪ್ರಾರಂಭ ಮಾಡೋಣ. ಭಾರತಿಯವರು ಅವರ ಪರಿಚಯ ಮಾಡಿಕೊಳ್ಳಲಿದ್ದಾರೆ.
ನಮಸ್ಕಾರ ಎಲ್ಲರಿಗೂ. Welcome you to this session, a wonderful session. I'm sure everybody is going to enjoy. ಇವತ್ತು ನನಗೆ ಹೆಮ್ಮೆ ಮತ್ತು ಬಹಳ ಸಂತೋಷ ಆಗ್ತಿದೆ to introduce you all to Dr. Lalitha. ಇವ್ರು ನನ್ನ ಗುರು ಮತ್ತೆ ನನ್ನ ಪ್ರೊಫೆಸರ್ ಆಯುರ್ವೇದ ಕಾಲೇಜ್ನಲ್ಲಿ. ನಾನು when I was studying Ayurvedic in the Ayurvedic college, ಇವ್ರು ನನ್ನ ಪ್ರೊಫೆಸರ್ ಆಗಿದ್ರು. ಸೊ ಐ ಕ್ಯಾನ್ ಬಿಲೀವ್ ಆಫ್ಟರ್ 27 years ನಾನು ಮತ್ತೆ ಅವ್ರನ್ನ ಎಲ್ಲಿ ಭೇಟಿ ಆಗ್ತಿದ್ದೀನಿ ಅನ್ಕೊಂಡೇ ಇರಲಿಲ್ಲ. ಸೊ ಐ ಆಮ್ so proud and honored to share the same platform with Dr. Lalitha. So Dr. Lalitha ಅವರು she's an MD in Ayurveda ಮತ್ತೆ PhD ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ. ಅವರು 35 years of clinical practice ಮತ್ತೆ 30 years of teaching experience ಇದೆ. And she has been guiding PhD students ಮತ್ತೆ MD students and with the 22 years of research work experience. She's an proud honoree to receive Chanakya and Ayurveda Bhushan Award anta. So it's really a very prestigious awards in Ayurvedic field that she has been an awardee. So really proud to present you all to her. She's also published more than 40 research publications, contributed several chapters in Ayurvedic textbooks and Ayurvedic pharmacopoeia dalli avara koduge ide. She's done a lot of work in research field. Keluvu, like she's also worked in Nimhans, Bangalore Nimhans Hospital, mental hospital. Most of you are aware of. She has done research work there as well on Ayurvedic, benefits of Ayurvedic herbs in management of mental disorders. So with not much wait, let's welcome Dr. Lalitha. Madam, please.
Yeah. Thank you, Bharati, for the introduction. I'm very happy to see you in Los Angeles after a long time. And I remember our old days teaching with you all. And it's a very happy time for me with you all. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ ಹಾಗೂ ಶುಭ ಸಂಜೆ. ಇವತ್ತಿನ ದಿನ ಒಂದು ಸುದಿನ ಅಂತ ಅನ್ಕೊಳ್ತೀನಿ. ಮನೆಯಲ್ಲೇ ಇದ್ದು ನನಗೆ ಬೇಜಾರಾಗ್ತಾ ಇತ್ತು. ಸೊ ಹಾಗಾಗಿ ಇದರಲ್ಲಿ ಸುಮಾರಷ್ಟು ಮಾತಾಡ್ಬೋದು ನಿಮ್ಮ ಜೊತೆ. ನನ್ನ ಪ್ಲಾನ್ಸ್, ನನ್ನ ಥಾಟ್ಸ್ ಎಲ್ಲ ಎಕ್ಸ್ಚೇಂಜ್ ಮಾಡ್ಬೋದು ಅಂತ ಅನ್ಕೊಳ್ತೀನಿ. ಟುಡೇ ಐ ವಿಲ್ ಬಿ ಸ್ಪೀಕಿಂಗ್ ಆನ್ health and diabetes. ಆಯುರ್ವೇದ ಸ್ಟ್ರಾಟಜಿ ಅಂಡ್ ಸೊಲ್ಯೂಷನ್ಸ್. ಈ ಆಯುರ್ವೇದದಲ್ಲಿ ನಾವು ಏನ್ ಮಾಡ್ಬೋದು, ಇದರಲ್ಲಿ ಹೌ ಟು ಟೇಕ್ ಕೇರ್ ಆಫ್ ಇಟ್, ಈ ಮಧುಮೇಹ ಯಾವ ತರ ನಾವು ಕೇರ್ ಮಾಡ್ಬೋದು, ಹೌ ಟು ಹ್ಯಾಂಡಲ್ ಡಯಾಬಿಟೀಸ್ ಮೆಲಿಟಸ್, ಅಂಡ್ ಥ್ರೂ ಲೈಫ್ ಸ್ಟೈಲ್ ಅಂಡ್ ಮೀಲ್ ಪ್ಲಾನ್ ಅಂಡ್ ಮೆಡಿಕಲ್ ನ್ಯೂಟ್ರಿಷನ್ ಥೆರಪಿ ಅಂತ ಬಂದಿದೆ ಈಗ. ಅದನ್ನ ಮುಂಚೆ ಇವಾಗ ಯಾರು ಡಯಟ್ ಅಂತ ಅದನ್ನ ಯಾರು ಹೇಳಲ್ಲ, ಈಗ ಮೆಡಿಕಲ್ ನ್ಯೂಟ್ರಿಷನ್ ಥೆರಪಿ ಅಂತ ಹೇಳ್ತಾರೆ. ಅದ್ರ ಬಗ್ಗೆ ನಾನು ಮಾತಾಡೋಕ್ಕೆ ಇಷ್ಟಪಡ್ತೇನೆ ಈಗ. ಅಂಡ್ ಇವಾಗ ಒಂದು ಈ ಒಳ್ಳೆ ಕಾರ್ಯಕ್ರಮ ಮಾಡ್ತಾ ಇದ್ದೀರಾ, ಸೊ ಹಾಗಾಗಿ ಧನ್ವಂತರಿಯನ್ನು ಪ್ರಾರ್ಥನೆ ಮಾಡಿ ನಾನು ಮಾಡೋಣ ಅಂತ ಹೇಳ್ತೀನಿ. ನಮಾಮಿ ಧನ್ವಂತರಿಂ ಆದಿದೇವಂ ಸುರ ಸುರೈ ವಂದಿತ ಪಾದ ಪದ್ಮಂ ಲೋಕೆ ಜರ ರುಕ್ ಭಯ ಮೃತ್ಯುನಾಶಂ ದಾತಾರಮೇಶಂ ವಿವಿಧೌಷಧೀನಾಂ. ಇದು ಧನ್ವಂತರಿಗೆ ಒಂದು ನಮಸ್ಕಾರ ಮಾಡ್ತಾ ಇದ್ದು ಶುರು ಮಾಡೋಣ. ಆಯುರ್ವೇದ ಏನಪ್ಪಾ ಅಂತಂದ್ರೆ ಧರ್ಮಾರ್ಥ ಕಾಮ ಮೋಕ್ಷಾಣ ಆಯುರ್ವೇದಂ ಮೂಲಮುತ್ತಮಂ. ಧರ್ಮ, ಬಿ ರೈಟಿಯಸ್, ಬಿ ಇನ್ ಎ ಲೀಗಲ್ ವೇ ಅಂತ ಹೇಳ್ತಾರೆ. ಅರ್ಥ ಅಂತಂದ ತಕ್ಷಣನೇ ಇದು ಫೈನಾನ್ಸ್ ಅಂತಲ್ಲ, ದ ಪವರ್ ಅಂಡ್ ಪ್ರಾಸ್ಪರಿಟಿ ಅಂತ ತಿಳ್ಕೊಬೋದು. ಹಾಗೆ ಕಾಮ ಅಂದ್ರೆ ಬರೀ ಡಿಸೈರ್ ಅಂತಲ್ಲ, ಕಾಮ ಏನೇ ಬೆಟರ್ ವೇ ಅಂಡ್ ಇಟ್ಸ್ ಯಾವ ತರ ನಾವು ಅಚೀವ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು, ಡಿಸೈರ್ ಅಂಡ್ ಲಾಂಗಿಂಗ್ಸ್, and in a legal way it is thought of, and moksha is a liberation. So that's what Ayurveda is also philosophical science. That is what it has been told. And ನಮ್ಮಲ್ಲಿ ಏನ್ ಹೇಳ್ತಾರೆ ಆಯುರ್ವೇದದಲ್ಲಿ ಸುಖಾಯು ಅಂಡ್ ದುಃಖಾಯು ಇದೆ, ಹಿತಾಯು ಅಹಿತಾಯು ಇದೆ. ಸುಖಾಯು, ಇನ್ ಸುಖಾಯು they already teach ದಿನಚರ್ಯ, ಋತುಚರ್ಯ, ಸದ್ವೃತ್ತ, ರಸಾಯನ, ವೃದ್ಧಾಪ್ಯದಲ್ಲಿ ನಾವು ಯಾವ ತರ ಹೆಲ್ತ್ ಕೇರ್ ಮಾಡ್ಬೋದು, ಯಾವ ತರ ನೋಡ್ಬೋದು, ಅದೂ ಸಹ ಬರುತ್ತೆ. ದುಃಖ ಅಂದ್ರೆ ಏನು, ನಾವು ಬರೀ ದುಃಖ ಅಂದ್ರೆ ಇಲ್ಲಿ ಅಡೋದು ಅಂತ ಬರಲ್ಲ, ಚಿಂತೆ ಅಂತ ಬರಲ್ಲ. ದುಃಖ ಅಂದ್ರೆ ಇಲ್ಲಿ ನಾವು ವ್ಯಾಧಿಗಳನ್ನ ಯಾವ ತರ ಮಾಡ್ಬೋದು, ಯಾವ ತರ ನಾವು ಹರಣೆ ಮಾಡ್ಬೋದು, ವ್ಯಾಧಿನ ಯಾವ ತರ ನಾವು ವಾಸಿ ಮಾಡ್ಕೋಬಹುದು, ಅದೂ ಬರುತ್ತೆ. ಏನ್ ಹೇಳ್ತಾರೆ ಅಂದ್ರೆ ಸ್ವಸ್ಥಸ್ಯ ಸ್ವಾಸ್ಥ್ಯ ರಕ್ಷಣ ಆತುರಸ್ಯ ರೋಗನದ್. ಸೊ ಮೇಂಟೈನಿಂಗ್ ಹೆಲ್ತ್ ಅಂಡ್ ಪ್ರಿವೆಂಟಿಂಗ್ ಅಂಡ್ ಕೇರ್ ಇಸ್ immediate and attention of Ayurveda, we can say that. And who is first, who is healthy basically. So in a person, wherever all the three doshas are balanced, all of you know what is vata, pitta and kapha. Vata is compared to neurological system, pitta to metabolism, kapha to immune system. And again, vata, acetylcholine is involved, pitta, serotonin is involved, and kapha, histamines are involved. And samadosha, all the doshas must be balanced one stage. And dhatu is systems, body systems. It can be lymphatic system, or it can be circulatory system, or musculoskeletal system, and so on. Here we call it as rasa, rakta, mamsa, meda, asti, majja and all. So dhatu must be functioning properly, doshas must be functioning properly, and agni is the most important thing. Digestive system must be functioning properly, and next is excretory system must be functioning properly. So then only who is called as svastha, that is physically, and psychologically who is called as svastha, healthy. There again the picture comes of the pleasant mind, senses and the soul. These three are the important things. So here one who is called as healthy is this. So WHO clearly says that physical, mental, social and spiritual well-being of the individual. Here Ayurveda has given importance to dosha, dhatu, then excretory systems and body systems, and of course the agni is the most important thing. And today is an important talk. I can say that we will be speaking on prameha and madhumeha. Before to understand the prameha and madhumeha, I get a patient of obesity, dyslipidemia, and he's obese. And he says when the accidentally sugar is chucked up, he has got raised blood sugar, and incidentally he has got thyroid problem also, and again there is PCOD also. Now it is called as PCOS, that is polycystic ovarian syndrome in ladies. So these three are conjoined: the obesity and diabetes, cardiovascular problems, and PCOD and thyroid. These are interlinked together. So these metabolic disorders have to be taken care. So once the diabetes comes, we have to be very much careful that, so these have to be checked up. So usually I tell the patients that get your blood sugar checked up fasting, then check the lipid profile, and liver profile, and again thyroid, what is the level, and of course if they are ladies, we scan them also, what is the uterine status. So here metabolic disorders, so why they come basically, so it can be a genetic, so they can be thin outside and fat inside. To look they'll be very thin, but they're very fat inside, so that is very genetic fat. So there'll be hypercholesteremia. And apart from that, there is if they are taking on antipsychotic drugs, so again the problem can be there, metabolic disorders can occur. Then obese patients, that can be there, unhealthy lifestyle. So these causes what? Hypertension, diabetes, and cardiovascular problems. So they have to be very much careful. So I feel that I say that better to start from 30 years only this garlic consuming. Instead, they can start taking this from 20 and all. Because if they're obese, better to start this garlic better. So what form you can take? You can ask me one question. There we call it as Lashuna Kshira Paka. That is processed milk. That is processed medicated milk could be taken. That is garlic is fried in little ghee. Then it is crushed. One part of the garlic and 8 parts of milk could be added. Then again 4 parts of water to be added, boiled very well. Once it is boiled well, boil till when only the milk portion is left. Then that is to be consumed early in the morning daily. So that will check the metabolic disorders. And other left side you can see another this thing that is known as Garcinia indica and what we call it as kokum. So drinking that every day, the decoction of that or in the juice form, or use kokum in curry, it is very good. So usually all these disease comes. So patient usually all the population there is hurry, worry, curry, and sorry we have become sorry. So that is what is happening. So you hurry in the morning and worry a lot, stress, plasma cortisol level is increased, vata is aggravated, and again curry, because if curry is more of spices, you can land up with the APDs, acid peptic disorders. That's one of the things. So these two things could be taken care of. So what are the important factors in Ayurveda? Important factors for this metabolic disorders are diabetes is the Agni. Agni is the most important thing. Digestive system must be functioning properly. So what do they do? Basically, so without being the digestion, when there is no digestion only, they keep on eating. That is, bhuktasya upari bhojanam. They eaten properly. Again, after 2 hours, friend is calling. Again, they eat. The food is not digested properly. That's one other thing. And there is Jatragni. Jatragni, it arises from the stomach. And Datvagni, it arises from all the tissues, that is Saptadhatus, Rasa, Rakta, Mamsa, Medo, etc. That is lymphatic system, circulatory system, and muscular system, and so on. And when these three are not functioning, Agni, Jatragni, and Datvagni, especially it leads to Ama. Ama is undigested food matter. This can lead to some toxins. So this toxin can cause a lot of disorders. Any disease you take in our Ayurveda, the Ama is an important factor to result in all the diseases. So they say that how do you assess Ama? How do you quantify Ama? Or how do you qualitatively, how do you see Ama basically? So they say that Ushmanaha alpabalatvena dhatu adim apachitam. The lymphatic system or the rasa, which is the first dhatu, it is not functioning properly by Ama. Then Ushnam, Amashagatam, that not digested food and the Agni goes to stomach and it start giving rise to a lot of problems. So then Kapha, and the Kapha is vitiated. Also this can lead to this disorder. And Medas, Kapha, Medas, Ama have to take care. Then there won't be any problem. This is what I just wanted to say in this. And coming on to this diabetes mellitus. So if you go to the pre-diabetic state, in US, 88 million people are suffering from this. 1 in 3 are suffering from this diabetes mellitus, and 84% do not know they have diabetic at all. So they do not know they have. So they just go on. So they are obese. Okay, they don't go to bother checkup also. They check up their blood also. That is what is happening. So in usually diabetes, the HB1AC is 6.5, and pre-diabetic state it is 5.1, and so on. And next, and normal sugar is, of course, it is 5. So there won't be any problem. So coming on to the diabetes type 1, it is known as diabetes insipidus. So usually it occurs in children. There, pancreas does not produce any insulin at all. There is no production of insulin. So usually it occurs in children, childhood diabetes it is called as, and their beta cell destruction is there, absolute insufficiency is there, and it occurs in younger age group. So what can we do? It is very difficult to treat them. Of course, there may be many claims that, okay, we can cure diabetes type 1. It is not so. It is very difficult. They have to be substituted by insulin itself. That's the most important thing that has to be thought of. And how does insulin work? What is the mechanics of insulin? So coming on to the mechanics, there is insulin receptors are there. Insulin is a hormone. The glucose channel it enters. Once it enters a glucose channel, there the glucose is released and utilized. Here there is a plant photo that is known as avenue tree, Lagostomia flos. So this bark and the leaves are very good in type 2 diabetes. So we have conducted a study recently, clinical study was conducted. It was able to reduce the blood sugar, fasting blood sugar from 300 to 150, like that it was managed. So for 1 month it was given. So here they say that insulin substance like is there. From the text only we took the reference and we studied on that drug. So flower also could be used. The bark and the leaves could be used here. And diabetes type 1. So many of them are not aware of that. This diabetes type 1, what happens is, it is known as LADA, latent autoimmune diseases in adults. So here, most of the autoimmune disorders can result in diabetes type 1. Here what happens is rheumatoid arthritis. It occurs in whenever there is a less of this body BMI is more than 25, it can occur. Or autoimmune disorder is there, weight loss is there, ketones are it's happening, ketones are there in the body, then it can happen to this. So in type 2 diabetes, what happens is, the mechanism, the stomach converts food into the glucose, then glucose enters the bloodstream, pancreas produces insulin, but it is resistant to effective use. It is not effective use at all, is not there. Then glucose is unable to enter the body effectively, then glucose level increase. So naturally glucose level increases type 2 diabetes. This is what happens in type 2. And other types of diabetes I just want to say on. So Modi, who do not know Modi, Prime Minister? But here that is not one. Yeah, maturity, onset, diabetes of the young. So in young age only they start getting this Modi, that is when their age is 20 only. So there the patient comes to us with recurrent skin infection and there is weight loss. The blurred vision he complains of. Leave alone this polyuria, polydipsia, and polyphagia, fatigue, etc. So they come with recurrent skin infection. There is weight loss, blood vision is there. So doctors especially, they must be aware, and they must be even the patients too, subjects too also, they must be aware of this situation. And endocrinopathies may be there. And type 3 diabetes. 3C diabetes is very much important. A person who has undergone this pancreatic surgery, cystic fibrosis, or pancreatitis, they have to be very much careful. It is known as type 1.5 diabetes. Of course, gestational diabetes also I can get it, and that's quite common. It is reversible, and drug-induced also reversible diabetes. Here, patient will be taking cortisones for one or the other reason, and steroid they'll be taking. Aspirin, for example, cardiac patients are given usually NMOS tablet. NMOS tablet they'll be taking as anticoagulant for a long time. Even that can also cause this diabetes. And phenytoin, psychotropic drugs, and so on, the list goes on. It is there in the slide, you can just see. So why is diabetes happening? I can say that modifiable risk factors, it is there in our hand. Physical inactivity, that could be changed. And overweight, weight could be managed. And of course, poor dietary habits. Here in the culture, what there is, cola, pizza, and pasta culture is that. That has to be changed, I think. And hypertension, even that could be managed. Smoking could be controlled. And non-modifiable are family history, nothing would be done. And of course, race and ethnicity is very difficult. Above 45 also it's very common. History of gestational diabetes also sometimes it's very difficult to non-modifiable. It occurs. And what are the goals, especially in these disorders? The fasting blood sugar must be 140 and below that, and postprandial must be less than 200. HbA1c, before everybody used to say 5. It is very difficult to get the patients with 5 only, diabetic patients. So it must be at least in between 6.2 to 7, and triglyceride must be 200, and of course BP, blood sugar must be 120 80. Now it is 130 90 at least at the age of 60 65 is also fine. And coming on to the blood glucose chart. So this is a common slide. We all know that. And normal is fasting is 80 to 100. And after 3 years of fasting, it can raise up to 140. And impaired glucose is 100 to 125. Here is a stage a patient or a subject or a normal public has to be aware of. Then they should start taking the food, which is food and diet. They can follow, they can yoga and everything. They'll be able to manage it. So diabetic is very difficult. It can go up till after 2 to 3 hours of eating. It can go up till 200 plus. So they have to be a little careful. And HbA1c, what must be the HbA1c? So it between 6 to 7, 6 to 6.5, or rather 7 is the maximum thing. They have to be a little careful. And this shows nearly 3 months assessment. From 3 months, they can see how much it is well controlled. And usually, what do they give in allopathic system? See, they usually give this fenformin, metformin, and everything. And what are the ADRs, adverse drug reaction? They have GI side effects is there, lactic acidosis is there, and they can land up with nausea and vomiting and diarrhea. And this is a drug is being shown in the right part. That is the root cause. The metformin, the content is Galaga officinalis. This Galaga officinalis is a plant-based medicine, and the extract has been taken out for that, and I've been giving that. So they have the roots of plant-based medicine in allopathic also. The same way, you must be knowing that aspirin, for example, acetyl salicylic acid is there in aspirin. I agree. There, what is the root cause? The plant-based, it is Salix caprea. Salix caprea is a plant, and that is a root. In the same way, nowadays they are getting this jasmine, and clonidine is there. It is a morphine derivative. In this jasmine, it is a jointed stem. So that portion is taken out and given to a patient in a decoction form, which is a natural source. It can reduce the pain very well. So this is the most important thing. So it was plant-based only. Naturally, it became synthetic, and hence they started getting all ADRs. So sulfonyl ureas are the next thing they give. Chloropropamide and tolbutamide they give, and they immediately the cause is hypoglycemia. That's one of the problems. That is known as sleeping diabetes. So in the morning it is maybe it is 100, 120 is there. Immediately it can come up to 60 and it can raise immediately. So that problem can occur with this. So from the perspective of this Ayurveda, what could be done? So first important thing is total diabetic care. What can we think of it? Normoglycemia is very important. That is, I've shown this drumstick leaves are very good. And again, this jamun, this very good, what we call as nerle and elargo gottide. That is most important thing. A special preparation is there in this jamun fruit. So what we do is jamun fruit is kept in honey, a bottle containing honey. It is kept for 2 months. Then the seed is taken out, it is pounded and taken well. Early in the morning, empty stomach, 1 spoon is taken. It gives wonderful result. The syrup could be used as a jam or a jelly. It is very good for the children with the bread and whatever it may be. That could be done. And again, this shunti, what says, that is ginger is very good again to control this lipid profile. So from this age only, from this period only, the shunti, that is ginger is given, it is a very good anticoagulant. It can take care of the cardia. So I advise all the patients to take this ginger, 1/2 inch to 1 inch early in the morning. When it's taken in the form of decoction form or in the powder form, it is very good anticoagulant. It can protect the cardia. They say that in our system, Bhojanagre sadapatyam lavanardrika bhakshanam. So before meals, half an hour or 1 hour before, ginger grating in salt is taken. The patient, I mean, any person, normal person also gets very good hunger and he can eat well. And no more tension. There won't be any there must be no hypertension must be. It must there must not be any BP or blood sugar or whatever it may be. That is, hypertension must not be there. Ashwagandha is one of the drug. It can be used in the form of processed milk form or in the tablet form and so on. And pre-diabetes and diabetic care. So in pre-diabetes, what we can do? Food and diet is the most important thing that is shown in another slide. And that is pre-diabetes is A. And here, exercise for 45 minutes, brisk walk, yogasanas could be done. So that will help the patient a lot. And in diabetes B, I can say that here, wherein which the fasting blood sugar is 200 mg per day, 2 to 3 year duration, anti-diabetic drugs, that is single drugs, ekamulika prayoga, like methi, then curry leaves, and so on, it could be tried. I'll come to that later. That could be taken into consideration. So we can manage this that is diabetes B with all herbal medicine. And in diabetes, pre-diabetes, that is A, so they can use this curry or methi or as a food form only they can take. They can add little more to the food and that could be taken. So that will help to combat that pre-diabetic state. Along with, of course, 45 minutes of walk, brisk walk, yogasanas and all. And chronic it becomes, for example, it is more than 6 years, the patient is panicky and polyuria, polyphagia, polydipsia, and tension, worry, and slowly the thyroid is coming into picture and hypertension is coming into picture. So their integrative medication is more important thing. Then Ayurveda becomes what? It becomes ekamulika prayoga, add-on therapy it becomes. There, along with rasayanas, rejuvenation is the most important thing we have to follow. So there is a limitation in Ayurveda also. Pre-diabetes, how we can manage, diabetic care, what we can do. So certain yogas could be done for the diabetes. That is Mandukasana, Pavanamuktasana, Bhujangasana, Symptomatic, and so on, Tadasana, etc. This Bhujangasana is one of the best asanas what I've seen and the patient can practice. There is Sanatana temple is there. Vyasa, the eminent doctors and the technical people teach over there. The yoga courses are there held. They can take a course over there. They can learn therapeutic yoga. They can do and to combat their diabetic problems or metabolic disorders. So coming on to this blood sugar alone, you don't have to think of it. You have to think of dyslipidemia and hypertension, central obesity are the important thing. Here I have shown long paper which we call it as Pipali. Pipali is very much important in dyslipidemia because it is a very good bioavailability enhancer. So once Pipali is given in the form of Kshirapaka or a churna, 1 to 2 grams, so this can be there in the system for a long time. It can combat dyslipidemia. Say plasma half-life could be enhanced there, and it is a very good drug, BA enhancer we say, that is bioavailability enhancer. At the same time, hypertension, I can say that ashwagandha is one of the best choice in the form of Kshirapaka or a churna. Again, the question comes at how much of churna could be taken. 2 to 3 grams could be taken in the form of Kshirapaka or churna. Nowadays, we are also getting the tablets that could be taken. So that can also control the diabetes and they get good sleep. And of course, hypertension is reduced and insomnia is also relieved to some extent. So they'll be able to sleep very well. And there's another question which starts, is diabetes, mellitus and hyperglycemia and madhumeha, all these are the same? Absolutely no. Diabetes mellitus, that is madhumeha, we can take it up. But madhumeha, there are other encountered problems are there. So that's what I just wanted to say that. So here, hyperglycemia is a state wherein which it can occur in madhumeha. It is not the madhumeha is not is equal to hyperglycemia. So there are other conditions also, other symptomatology also is there in Madhumeha. And it is mainly Vata originated, I can say that. So let us come to the Ayurvedic approach. So in Ayurvedic approach, they say that what are the causes? So they say that related to reduced physical activity, and it's a direct activity, I can say that. Asya Sukam Sapna Sukam. It is a sedentary lifestyles, Gramya Audaka Anupa Rasaha Mamsa, they say that. So they take smoked mutton, they may cause type 1 diabetes and type 2 also from the long time. And of course, type 1 is always genetic. And milk and milk products. Early introduction of the cow's milk, it can lead to this diabetes 1 and 2 also. And these curds, and especially curd prepared and kept in the fridge, it's not at all good. So the usually what in US we do, take the curd, it is kept in the fridge. We do not know the origin of it. It may be from buffalo, whatever it may be, and it is maybe it's auxin and gibberellins are maybe induced into that, and that can cause a lot of problem. Organic cuts we are getting, that would be much safe, I think. So and newly harvested rice with they have got high calorific values. They aggravate kapha. That's one of the important thing. So usually we say that manali ಏನು ಹೇಳ್ತೀವಿ ಅಂದ್ರೆ ಹಳೆ ಅಕ್ಕಿ ಯೂಸ್ ಮಾಡಿ, which is good for the thing. So from our ancestor time only we have been using this old rice. So because that is good for the thing, it has got better values, I can say that. And all excessive intake of sugars and carbohydrates is an important thing. Here I've seen this nulkol, and there's all of you must be knowing this gargam. Gargam is cluster beans, we say that, gorika and heltivi. So those seeds are very good for diabetes. So that it is we get it in the market as gargam only. Gargam is very good drug. See, I wanted to say one more thing. Ahara is always rasapradana. When you take the food, it is always taste predominant. When you take aushadha, when you take the drug as aushadha, it becomes virya pradana. So the potency of the drug starts acting when you give it when you give the drug in a more quantity. The same drug is given in, it could be given in a food form also. Then the rasa becomes the most predominant thing. And prameha, there are 20 types of prameha. There albuminuria comes, and udakameha, ikshumeha, and so on. There are 20 types. So I'll not go to the details of it. I'll concentrate only on madhumeha. In madhumeha, the patient passes the urine, which is honey-like. It's a thing, important thing. And here it is prameha and madhumeha. So Triphala is a best drug, I can say that. Triphala in the form of decoction form or in the form of churna form is the best thing, or in the tablet form, it is very good. And Trikatu, which is also very good for in these two conditions. So next, let us come to that, how to take it. Triphala and Trikatu, they can make a combination. Triphala 1 spoon and Trikatu 1 spoon. So decoction is made, 1 part of the drug, 8 parts of water, reduced to 1/4. So daily taken, it can combat it. And what are the symptoms? So all of us know that polyphagia, polydipsia, and polyuria, that everybody knows. The patient alert. And nowadays we are not getting the case like that. So way back in 5 months or 6 months back, I got a patient that the patient is landed up with UTI, E. coli. So whatever we are doing, the infection is not going. Check the urine. He's got fasting blood sugar is very high. And skin infection. The patient has got skin infection, and itching is there, and pruritus vulvae, vagina, there is itching is there. The patient says that. Again, we check the urine. There is blood sugar and urine. The fasting blood sugar, it is raised. It can present also like that. This is for the awareness of the all public, I'm just saying. And there can be numbness also. So numbness. So these are the things they have to be aware of that. And apart from that, it can usually in ladies or men. So they will be darkening of the skin around the neck, especially the posterior aspect is darkening of the skin. So any way, I feel that 30, 35 plus year obese, etc., go for the checkup. That is fasting blood sugar, lipid profile, liver profile, thyroid. That's all. So that is for the safety is the better value, I feel that. So what are the complications of diabetes? So the first thing is, once a patient is diabetic, so it can kill the patient very slowly. The patient can have the silent attack. The deep sleep only, the patient can pass away. MI, myocardial, it can be acute myocardial infarction. That can be due to diabetes also. So cardiomyopathies can occur, and not like that hypertension is there and blood sugar is raised, not like that. Blood sugar is raised and hypertension is not there. Only hypercholesteremia is there. Immediately it can block the artery, it can block the coronary artery, left bundle branch block or right bundle branch block, it can create and it can happen. So always they must be quite aware of that. That is, cardiomyopathies can occur and nephropathy. So this nephropathy, when it occurs, slowly what happens, the patient is diabetic, uncontrolled diabetes and uncontrolled hyperlipidemia. There is that. Slowly it start leading to nephropathy. In nephropathy, usually blood urea is increased and serum creatinine is increased. That's an important thing. So what is blood urea is 40, it will raise to 50, 60. Then creatinine 1.5 is a normal level. It will start increasing. So they had to be aware of that. That's what I'm saying that. So once the patient get blurriness of the vision, they had to be very much careful. That is retinopathy is a thing. So once the patient becomes diabetic, diagnosed as diabetic, fasting blood sugar is not controlled well through this diet and other things, they had to see the doctor for cardiac evaluation. And of course, this at least they can they can have an ECG. And ECG, one more I just wanted to say that when the patient has got heart attack only, the ECG can show the readings. Otherwise, though the patient is a cardiac patient, does not show any results. It does not give anything. So echocardiography is the most important thing to be done. So that the doctor will advise when to be done. You can meeting the doctor and going for investigation to be done. And brain, of course, stroke is the most important thing. So there again, uncontrolled nephropathy and this stroke can occur when the diabetes is not well controlled at all. And the care and the management, what could be done? Of course, the food, education, and all those things are there. We can switch on to the next slide. Here, again, I say that why this Triphala is very important. Triphala can do wonders. So Triphala is Amalaki, Haritake, Vibhitake. It's the most important thing. So Amalaki gooseberry, Haritake is Terminalia, Chibula, Alelakai Panditrantana, Karita Ayurvedan doctorna, Largu Buttiroage, and Vibhitake is Terminalia Belirica. These three drugs are there. Here it can be used as 1:1:1 proportion. And it has got hypoglycemic activities, proved through research that it has got hypoglycemic activity and it has got lipid lowering activity and cardiotonic activity. Cardioprotective activity is also there. When these three activities are there, we can switch on to Triphala. Triphala Kashaya could be taken, or Triphala Churna could be taken, or Triphala tablets could be taken. Triphala is also a very good drug which can relieve the constipation also. The dose, the dosage form, how we are giving, and the duration is the most important thing. Please consult the doctor before the use. And of course, a diabetic patient comes to you, anybody like that. The first thing, foremost thing is they say that, Doctor, ಬಾಯಲ್ಲಿ ಯಾಕೋ ವಾಸನೆ ಬರ್ತಾ ಇದೆ, ಏನ್ ಮಾಡಿದ್ರು ಹೋಗಲ್ಲ, ಹಲ್ಲು ಇಜ್ಜಿದ್ರು ಹೋಗಲ್ಲ, ಗಮ್ ಟರ್ನ್ ಯೂಸ್ ಮಾಡಿದ್ರು ಹೋಗಲ್ಲ, ಏನ್ ಮಾಡೋದು, they say that. So please check his blood sugar, most important thing. So what could be done for the diabetic patients with the dental problem? The first and foremost thing is, very well, Triphala, clove, that is lavanga, what you call it as salt. How much to be used? Triphala 1 part. Lavanga is a very good analgesic and pain reliever, and quarter part, and salt quantity sufficient, a pinch is sufficient. So these three things together, along with sesame oil. So tila taila anta naven heltivi, till oil, that could be mixed and daily. It could be applied to the gums. It's very good. Okay, they can brush the teeth with whatever the paste they want. Later on, they can apply that. That will give a very good result. And the patient is diabetic. He is not aware of it. And it is a doctor's duty, first and foremost duty, to send them for blood sugar level and so on. The patient says that I have got shoulder pain and burning of the feet, and burning sensation is there in the feet. That can be due to peripheral neuropathy and sweating frequently, and the patient is very weak. So chronic fatigue is there. What to do? The patients feel very much tired. Joint pain is there. The patient thinks that, oh, I'm aged, it is happening. So immediately the patient's blood sugar must be checked. So here, what could be done? So there is methi, that is fenugreek is there, and it is a very good analgesic. And brahmi, that is what you call as bacopa monnieri, it is very good. It has got anti-rheumatic activity. So it's very good for pain. These two drugs could be combined and given to the patient. 1 gram of methi powder and 1 gram of bacopa monnieri. This is available as capsules also, and bacopa monnieri that could be given for the pain. And again, this methi is a very good drug for diabetes also. That could be taken off. And for the pain, what could be done? So methi powder decoction is made and add jaggery and camphor. That's all, nothing else. These three together, it is boiled very well. So as I've told that 1 part of the drug, 8 parts of water, and reduced to 1/4. Decoction is made a little bit thick. Add jaggery and camphor, and egg also could be added to that. Egg with yolk also, yellow part also could be taken, added very well, boiled very well. And because camphor is there, it's a very good preservative that could be applied over the local joint. In fact, a plasters could be prepared out of it. Ointment could be prepared out of it. So, and nothing will happen because it is a very good preservative. And coming on to the Nisha Amalaki Guruchi. So Nisha, you know very well, turmeric, and Amalaki is gooseberry, and this is Guruchi, what I'm showing, that is Tinospora cardifolia. And these 3 drugs are very good in diabetes mellitus. That is pre-diabetic state, as a food could be taken, or in diabetic state also it could be taken. So again, I tell how to do this. Nisha, that is Haridra 1 part, and Amalaki 1 part, that is pulp. And this Guruchi, you have to take the juice of it. And these 1 part of Haridra, that is 1 part of Amalaki, chuna, and equal quantity. And to that powder, this Guruchi, you know what is that, Tinospora cardifolia, juice is taken out from the stem. Then trituration is done to these 2 chunas, and it could be made into a mass, and 1 spoon could be taken. Or else, what you can do is 1 part of turmeric, 1 part of gooseberry, and Guruchi capsules are available. That could be taken. So there is a famous preparation in our college we used to follow, Guruchi Bhavita Nisha Amalaki. So Guruchi is triturated with turmeric and avla powder. So that can control the diabetes very well. So simply if I say that, okay, Guruchi you take, avla you take, and gooseberry you take, and turmeric you take, no, the method of preparation is also important. These things could be done at home only. Guruchi powder also you get it. So that could be triturated, and it could be prepared. And here few drugs are there. Of course, again, Shunti is there, and Gudamar and so on is there. So it is how they act like on the liver, the adipose tissue, and the muscle, pancreas, and the intestine. And there are about 21 diabetic drugs. These drugs are there. Anti-diabetic drugs are there. Here, onion, cumin, fenugreek, aloe, cinnamon, tulsi, ginseng, and so on. But among all these things, what I found effective is cumin is very good, and fenugreek is very good. Cinnamon is very good. So cinnamon, if you take as a decoction, is very good. 1 spoon of cinnamon, add it in hot water, and just take it as an infusion, hot infusion. That is very good. In summer, again 1 part of the drug, add 6 part of water. As a cold infusion, it could be taken. So bitter gourd also is there. I'll come to that next part. And all of us say that hagalkai togobeku, bitter gourd togobeku. We call it as caravella. And these are methi, the cinnamon, and avla, and so on. But you have to be very careful when you take this bitter gourd juice. You cannot take bitter gourd juice as and when you want. So take, okay, 10 ml, doctor says you keep on taking 10 ml for 3 months. What will happen? It will aggravate vata. nervous system, neurological system could be hampered. They can start getting cramps and so on. So that's the most important thing. How to take it is the most important thing. How long it has to be taken. Please consult a doctor and take. So any drug which has got tiktarasa, bitter taste, is good for diabetes. I can say that. But if it is going for katuvipaka, for a long time, it is not good. But Katu rasa, tikta rasa, and mother vipaka drugs are good. So when it goes in for sweet transformation, it is good for the body. It acts very well. So in that matter, this avla is a good, though it is avla rasa and it is mother vipaka is there, that is good for the body, I can say that. But my advice and precaution is, before taking bitter gourd juice, you have to be a little careful. Consult the doctor only, please, and take it. And herbal tea could be done. This anybody can follow. Barley powder 1 part, cinnamon 1 part, fenugreek half a part could be taken. Ginger powder 1/4 part. Salt quantity sufficient. To the water, add all these things, some 200 ml of water, and you can just boil it and take it. So this will be very much beneficial as a herbal tea. As cinnamon is there, it will take care of the sweetness you will get. It will take care of the sweet, and it is very tasty also. And you're adding ginger powder and salt. This will be very much beneficial for all the normal patients. And as a this subnormal subject also, this could be drank early in the morning in the empty stomach. Ginger is a very good digestion. Fenugreek, it increases appetite, and barley powder is very good for obesity. And you can make an anti-diabetic powder at home only. It's very easy. So you must be having this allium sepa, that is onion is there. It's a very good anti-diabetic drug. And this ela, what we call it as elakki anta gottalla ellargu gottaide. That is, the bigger variety has to be taken. It is known as Amomum sublatum. Even it has got hypoglycemic activity. And cinnamon, it has got lipolytic activity, and neem is anti-hyperglycemic activity, and Murea koinigi, that is curry leaf, is very good, and Moringa pterygosperma, drumstick leaves are very good. So these, a combination could be made and it could be taken. And as the cinnamon is lipolytic, so this could be used in obesity also. So combination could be made, and this could be taken, and this will help the diabetic patients too. And what recipes could be done? So don't be thin outside and fat inside. So here it can take care of the obesity also. It can take care of the diabetes also. Here they say that in diet, if you just go, there is Okinawa diet is there, then keto diet is there, rainbow diet is there. There are different types of diets. It's coming into picture. Some say you take only fat food diet. Some take protein diet. They say avoid carb diet. So this could be followed, I think. Coconut powder or almond powder could be thought. Oats is an important thing. Barley powder, gooseberry powder, methi powder, curry leaf powder, water, thin curds, and salt. So this could be done for the pancakes. It could be done, or chapatis could be made out of it, and it could be made as a chutney powder and could be used. So when salt is put, this will do. At any diet, you follow these things, recipes. So you please check your blood sugar before and after. So it will give a sort of benchmark. So it can be assessed very well how much it can reduce this. And Amruta, I can say that for all diabetic patients. So it is known as a diabetic medical nutrition therapy. So Ekamulika Prayoga, what we say, is a combination therapy here. So A stands for Avla Amalaki, M for Methi, R for Ragi, and black gram we call it as Urad Dal, and Twak we call it as cinnamon is Twak, and horse gram, H is for horse gram, and A is for again Amruta or Gudji. This is a very good combination we have tried before, and Amruta nectar for all these diabetic patients could be tried, and is very good. So since ragi is there, you can make a thick ragi porridge, add amla powder, methi powder, and of course this urad dal. fry it and use it. And even horse gram also, make it warm, fry it and use it. That will be good. And cinnamon is there and guduchi. So this is a very good combination. This will help the patient to reduce the blood sugar level. So they can follow this. And what is a diabetic meal plan? The meal plan, they say that 50% must be leafy vegetables and 25% must be protein. 25% must be carb. You can read if you are able to digest if you are not able to take more protein, you can add a bit of carbohydrate. If you are able to cut down carbohydrate, it is much better. What I suggest. So here there are many lentils. Green gram is there, peas are there, horse gram, lentils, there are many things. Oranges are there, carrot are there, avocados. So this diabetic meal plan could be thought of it. And what I suggest is lentils pancake could be made. So of course green gram dosa is very good. So to say it is very easy, you say that, but it is in the mind, in the patient's mind they have to follow. Body is a temple of mind, so they can follow whatever, where there is a wish, the will and wish is there, you can really do that. And please avoid the milk, the sugar, maida, what we call it as refined wheat flour, or cake flour, what we call it as, and rice and salt to be avoided. So rice, I know it increases carb. Salt again is not good for diabetes and hypertensive patients, and sugar to be avoided. So you can ask me what sugar. So jaggery could be used. Jaggery in a low quantity is better. So that's also important thing. There is another drug known as stevia rhabidinea. It's a biosweetener. When that could be used. So it's a biosweetener that could be thought of it instead of using saccharin. Biosweetener, that is stevia rhabidinea, could be thought of. So which is more sugary, for example? You can ask me that which fruits could be taken. So best is avocado, watermelon, the berries, papayas, guava could be taken off. If you go to the mango, there's highest content, and even the grapes, please don't take them. The jackfruit is not advisable. So stick on to this papaya, guava, watermelon, avocado, and so on. So that will be better. On the berries, all the berries are very good. So berries are very good antidiabetics also. It can reduce the fructose level. Plus, these berries, what they do is they can also reduce weight. So there's very good laxative too. And of course, I've given a diabetic food list is there. You can just take it out. So what could be followed, what food could be taken, and what food should not be taken also is there. And diabetes ultimately, pancreas says that clearly that I'm not lazy. I'm not ill, pancreas, I'm not ill. My pancreas is just becoming lazy. It is becoming lazy. So I have high blood sugar, type 2 diabetes, it's not going to kill me. Eat right, and diet and exercise, lose weight, and you watch yourself, and that could be the best, I think. In our this thing also, what this is, santarpanokta and apatarpanokta, catabolic and anabolic, both the types of diabetes are there. That is, one in santarpana, the patient will be quite obese. So there the different therapy is there. And apatarpanokta, the patient is very lean. So there are different types how we can manage. And of course, they can ask me one question that ragi, wheat, rice, all of them have got carbs only. But in ragi, only 300 grams of it is got less carbs. That is on the millets. So there is a different millets are there. Even millets could be thought of. And everybody says that reversal of diabetes, is it okay? It is not reversal, it is remission of the diabetes that should be thought of. It is remission of the diabetes, not reversal. Of course, you can see in YouTube video, okay, reversal could be done. Reversal is there after 6 years also, the patient is not diabetic. Then you can say that, okay, diabetes vanished. They say that in Ayurveda, Jata Pramehi Madhumehinovaha Na hi sadhya uktaha. It is not possible. It is one of the Mahagada. It is Ashtamahagada, they say that. One of the major disorders which is not possible to cure. But it could be managed properly and well maintained, and there won't be any problem. And as all of you know that November 4th, is World Diabetic Day, and I feel that could be celebrated very well, and keeping ourselves very healthy. And diabetes is a non-communicable disease, they say that. And rice, I can say that lysine is very less, and methionine is more. So pulses, methionine is more, lysine is less. And one cola gives 12 cubes of sugar. So what is the usual thing? They say keep on taking the cans of cola. Is it right on your part? Please think over. And that is the most important thing. And Ayurveda nidana alla. ನಿಧಾನವಾಗಿ ಆಯುರ್ವೇದಕ್ಕೆ ಬರಬಾರ್ದು. If you come at the complications, when your renal failure is there and there is cardiomyopathy is established very well, what could be done? If you come early, we can completely manage very well, I feel that. And exercises, I wanted to say that it increases endorphins. So exercises minimum 45 minutes, at least brisk walk 4 times a week. That would be very much appreciated, I feel that. And apart from that, ಆಹಾರವೇ ಔಷಧವಾಗಿರಬೇಕು. ಅಂದ್ರೆ ಆಹಾರ ಜಾಸ್ತಿ ತಗೊಳ್ಳಿ, ಒಳ್ಳೆ ಆಹಾರ ತಗೊಳ್ಳಿ, ಅಂಡ್ ಔಷಧ ಆಹಾರ ಆಗದೆ ಇರಲಿ. ಔಷಧನೇ ಏನಾಗುತ್ತೆ, ಡೋಂಟ್ ಬಿ ಎ ಪಿಲ್ ಪುಷರ್. ಇವಾಗ ಬೆಳಗ್ಗೆ ಆದ ತಕ್ಷಣ 10 ಟ್ಯಾಬ್ಲೆಟ್ ತಗೊಂಡ್ರೆ ಹೌ ದ ಪೇಷಂಟ್ ಕ್ಯಾನ್ ಲಿವ್? ಇಟ್ಸ್ ಹೈಲಿ ಇಂಪಾಸಿಬಲ್, isn't it? So what food will be digested? Only medicine. So what comes out from your body is only the excretory products. Is the most of the thing is the products which is not at all good for the body. So there can be many areas. There can be drug to drug reaction, herb to drug reaction, herb to drug reaction. So it is the wise man's approach that how to use the medications in how to use food in the anti-diabetic food in pre-diabetes, and anti-diabetic drugs especially quoted as medicine in diabetes. And before using these medication in diabetic state, when the blood sugar is, fasting blood sugar is more than 200, please don't forget to consult a doctor and have an appointment and say that I'm doing like this. That is the most important thing. And liver is the most important thing you have to take care. Liver is a lever of life, they say that. It's a lever. If liver is not functioning, slowly it happens. Fatty liver is occurring. So they have to take care more. And I feel that it's we are coming to finishing this, and I'm say that finally I say that live and lead a healthy life in journey of our life. So sarve jana sukhino bhavantu vasudhaiva kutumbakam. All the whole world in this life journey is there, and we have to take care of our health and be healthy and happy, always with the peace of mind. Thank you one and all for listening, and any questions are there, we can think of it. Yeah.
ಬಹಳ ಚೆನ್ನಾಗಿತ್ತು ಡಾಕ್ಟರ್ ಲಲಿತಾ ಅವರೇ. ಅಲ್ಲ, ನಾಟ್ ಓನ್ಲಿ ನೀವುಗಳು ಡಯಾಬಿಟಿಸ್ ಬಗ್ಗೆ ಹೇಳಿದ್ರಿ, ಅಷ್ಟಲ್ದೇನೆ ಏನ್ ತಿನ್ಬೇಕು, ಏನ್ ತಿನ್ಬಾರ್ದು, ಯಾವ ತರದ್ದು ಔಷಧಿಗಳು ನಮ್ಮಲ್ಲಿ ಆಗ್ಲೇ ಇದೆ ಅನ್ನೋದನ್ನ ತಿಳಿಸ್ಕೊಟ್ರಿ. ನನಗೊಂದ್ಸತಿ ನೋಟ್ಸ್ ಕೂಡ ಮಾಡ್ಕೊಂಡಿದೀನಿ, ನಾನು ಬಹಳ ಫಾಸ್ಟ್ ಆಗಿ ಬರ್ಕೊಳಕ್ ಆಗ್ಲಿಲ್ಲ. ಎಷ್ಟೋ ಪ್ರಶ್ನೆಗಳಿದೆ, ಆದ್ರೆ ಒಂದನ್ನ ನಾನ್ ಕೇಳ್ಬೇಕು ನಿಮ್ಮನ್ನ. ಅಕ್ಕಿ ಬಗ್ಗೆ ಮಾತಾಡಿದ್ರಿ, ಹಳೆ ಅಕ್ಕಿ ತಿನ್ಬೇಕು ಅಂತ ಅಂದ್ಬಿಟ್ಟು. ಯಾವಾಗ್ಲೂ ಒಂದ್ ಪ್ರಶ್ನೆ, ನೀವು ಬ್ರೌನ್ ರೈಸ್ ತಿನ್ನಿ ಅಂತ ಒಂದ್ಸತಿ ಹೇಳ್ತಾರೆ, ಒಂದ್ಸತಿ ರೆಗ್ಯುಲರ್ ರೈಸ್ ಪರವಾಗಿಲ್ಲ ಅಂತಾರೆ. ಯಾವ್ದು ಸರಿ, ಯಾವ್ದು ತಪ್ಪು?
ನಾನೇ ಹೇಳೋದಂದ್ರೆ ವೈಟ್ ರೈಸ್ಗಿಂತ ಬ್ರೌನ್ ರೈಸ್ ತಗೊಳ್ಳಿ. ಬ್ರೌನ್ ರೈಸ್ ಇಸ್ ಬೆಟರ್. Glycemic index it can reduce it. It can reduce the hyperglycemia. But apart from that, you are taking other these things also. Antandre, okay, the bakery stuff and all, that is the not good. But the concept of health should start from the early age only. I feel that like after 30, 40, no. So before only that this thought should be thought of all these metabolic disorders. So they have to take care of not only diabetes, the obesity, the cardiac thing. Check once in a year, they can go for the checkup and see that. That will be much better, I feel that. Yeah.
ಥ್ಯಾಂಕ್ ಯು. ಆಮೇಲೆ ಇನ್ನೊಂದು ಪ್ರಶ್ನೆ, ಮಿಲೆಟ್ಸ್ ಬಗ್ಗೆ ಮಾತಾಡಿದ್ರಿ ನಾವು. ಅದರಲ್ಲಿ ಯಾವ್ದು ಧಾನ್ಯ, ಅದರಲ್ಲಿ ರಾಗಿ ಗೊತ್ತು ನಮ್ಗೆ, ಇನ್ಯಾವ್ದಾದ್ರು ಧಾನ್ಯ ಒಳ್ಳೇದಾ ಅಲ್ವಾ?
ಅಲ್ಲಿ ನಾನೇನ್ ಹೇಳ್ತೀನಿ ಅಂದ್ರೆ, ಇವಾಗ there are ಬರ್ಕ್ಲು, ಓರ್ಲ ಎಲ್ಲ ಸುಮಾರಷ್ಟು ಮಿಲೆಟ್ಸ್ ಇದೆ. ಅದೇನಾಗತ್ತೆ ಅಂತಂದ್ರೆ ಅದು ತಗೊಳ್ಬೋದು, ಏನಾಗಲ್ಲ. ಅದು ಲಾಂಗ್ ಟರ್ಮ್ ತಗೊಳ್ತಾ ಇತ್ತು ಅಂತಂದ್ರೆ ವಾಟ್ ಹ್ಯಾಪನ್ಸ್ ಇಸ್ ಅಗೈನ್ ದರ್ ಇಸ್ ಇಟ್ ಗೋಸ್ ಇನ್ ಎ ಕೆಟಬಾಲಿಕ್ ಸ್ಟೇಟ್. ಇವೆಲ್ಲ ನಮ್ಮಲ್ಲಿ ಏನ್ ಹೇಳ್ತಾರೆ ಅಂದ್ರೆ ಕುಧಾನ್ಯಗಳು ಅಂತ ಹೇಳ್ತಾರೆ, ಅಂದ್ರೆ ದಿಸ್ ನಾಟ್ ಟು ಬಿ ಯೂಸ್ಡ್ ಅಂತ. ಬಟ್ ಹಿಯರ್ ಇಟ್ ಕುಡ್ ಬಿ ಯೂಸ್, ಬಟ್ at a this thing, for example, if you are using this ಧಾನ್ಯ, ಮತ್ತೆ ಸಿರಿಧಾನ್ಯಗಳು ಯೂಸ್ ಮಾಡಿ ಅಂತಂದ್ರೆ ವೀಕ್ಲಿ ಥ್ರೈಸ್ ಯೂಸ್ ಮಾಡಿ. 2 ದಿನ, ಒಂದಿನ ಗೋ ಫಾರ್ ವೀಟ್ and one ದಿನ ಯುವರ್ ಬ್ರೌನ್ ರೈಸ್, then this siridhanya 1 or 2 days, that way. Only vegetables you can think of it, a little of ragi, that would be better, I feel that. And ಯೋಚನೆ ಇದೆಲ್ಲ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್, ಬಿಕಾಸ್ ಆನ್ ಎ ಲಾಂಗ್ ಟರ್ಮ್ ಇವನ್ ದಟ್ ಈಸ್ ಆಲ್ಸೋ ನಾಟ್ ಗುಡ್. ಅಂಡ್ ಎಲ್ಲರೂ ಹೇಳ್ತಾರೆ ತುಪ್ಪ ತಗೋಬಾರ್ದು ಅಂತ. ಇಫ್ ಯು ಆರ್ ಏಬಲ್ ಟು ಮೆಟಬಲೈಸ್, ವೈ ನಾಟ್ ಘೀ 1 spoon, isn't it? Yeah.
ಬಹಳ ಸಂತೋಷ ನಿಮ್ ಮಾತು ಕೇಳಿಸ್ಕೊಂಡು. ಇನ್ನು ಎಷ್ಟೊಂದ್ ಜನ ನಿಮ್ ಪ್ರಶ್ನೆಗಳು ಕೇಳಕ್ ಕಾಯ್ತಾ ಇದ್ದಾರೆ. ಧನ್ಯವಾದಗಳು ಡಾಕ್ಟರ್ ಲಲಿತಾ ಅವರೇ.
Thank you. Yes.
ನಮಸ್ಕಾರ ಡಾಕ್ಟರ್ ಲಲಿತಾ ಅವರೇ.
ನಮಸ್ಕಾರ.
You touched upon ama ಅಂತ. Ama ಅಂದ್ರೆ is that like something produced in the stomach lining?
Yeah, ama is one factor that it can produce toxin at the level of stomach, at the level of intestine also. That is what we call as jatragni mandhyajanya ama antivi. Jatragni ಅಂತಂದ್ರೆ ಸ್ಟಮಕ್, ಜಠರ ಅಂದ್ರೆ ಸ್ಟಮಕ್, ಅಲ್ಲಿ ಪ್ರೊಡ್ಯೂಸ್ ಆಗುವಂಥದ್ದು ಒಂದು ಆಮ. ಸೊ ಆಮ ಇದ್ದಾಗ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ there is fatigue. Again, I can tell one shloka, but ಶ್ರೋತೋರೋಧ ಬಲಭ್ರಂಶ ಗೌರವ ಅನಿಲ ಮೂಢತ ಆಲಸ್ಯ ಅಪಕ್ತಿ ನಿಷ್ಠೀವ ಮಲಸಂಗಾರುಚಿ ಕ್ರಮ. ಮಲಸಂಗ ಅಂದ್ರೆ ಎಕ್ಸ್ಕ್ರಿಟರಿ ಫಂಕ್ಷನ್ ಆಗ್ತಾ ಇರಲ್ಲ, there is fatigue and the body is very heavy, there is no appetite, there is no hunger, that happens. So this is why this happens, because the food is not digested properly. And usually what they do is they take food, they say that yama madhye na bhoktavyam yama yugmam na langaye. One yama andre 3 hours, yama madhye na bhoktavyam, in between 3 hours don't eat. But we have the habit of eating 10 o'clock we eat, again 11 o'clock we want to eat something snack, again we eat. That should not be done. Yama yugmam 2 snack. So once in 3 hours don't eat, and after 6 hours 2 yamas don't fast. So that is a regular food habits. So that should be followed, and that is one is ama. And it is like a toxin, it can give rise to any disease. Whenever whichever system, your body system is weak, it can enter into that, and it can cause any disease. For example, rheumatoid arthritis, or I can say that acid peptic disorders, amla pitta varutte, or you can say that rakta pitta anta heltivi. Any disease like bleeding disorders, anything you can say that ama is an important factor it can cause. It is originated from, one is stomach, jatragni, and other one is from dhatus, all the skeletal, that is all the system, body systems, that is lymphatic, circulatory, musculoskeletal, and so on. It is rasa, rakta, mamsa, meda, asti, majja, shukra anta heltivi. Sapta dhatus are there. Agni, particular digestive capacity, that particular fire, particular skeletal, particular system, the agni hamper adaga, it can cause the particular disease. Because rasa dhatvagni aitu antandre it can cause rheumatoid disease, and it can cause agni-mandya, indigestion, and so on. Rakta aitu it can cause gout, like that, anemia, and so on.
Just a follow-up question.
Yeah.
Indigestion is caused by bad food, lethargy. Is there any connection between indigestion and headaches?
Yeah, there is a relationship between indigestion and headache. So what happens is we call it as agni-mandya. When agni is not functioning, it leads to agni-mandya, so indigestion. So there the food is not digested. So the vata, agni is also hampered, pitta, and in turn it vitiates vata. It can cause the headache. And usually amla pitta anta ನಾವು ಹೇಳ್ತೀವಲ್ಲ, that is hyperacidity. What happens is there is headache is there, vomiting is there because of this only. Agni is being hampered. Yeah.
Okay, thank you.
Yeah, thank you. Yes. ಏನಾದ್ರು ಕ್ವಶನ್ಸ್ ಇದೆಯಾ, ಕೇಳ್ಬೇಕಾ?
ಯಾ ಸಾರಿ, ಮ್ಯೂಟ್ ಮೇಲೆ ಇತ್ತು. ನೀವು ಕೊಟ್ಟ ಈ lecture, it was very nice, and all the details were very interesting. Nandu one question andre, you mentioned there is a relation to fatty liver condition if there is diabetes anta. Is there any way to address the fatty liver condition, even the condition?
ಫ್ಯಾಟಿ ಲಿವರ್ ನಾವು ಪರಿಹಾರಕ್ಕೆ ಸಮಸ್ಯೆಗೆ ನೋಡ್ಕೋಬೇಕಂತಂದ್ರೆ ಫಸ್ಟು ಈಟಿಂಗ್ ಹ್ಯಾಬಿಟ್ಸ್ ಕರೆಕ್ಟಾಗಿ ನೋಡ್ಕೋಬೇಕು, ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್. ಆಮೇಲೆ ಏನಪ್ಪ ಅಂತಂದ್ರೆ, ಐ ಟೋಲ್ಡ್ ಯು ಇನ್ ಎ ಸಿಂಪಲ್ ವೇ ದಟ್ ದಿಸ್ ಗುಡುಚಿ ಈಸ್ ವೆರಿ ಗುಡ್ ಆ್ಯಂಡ್ ginger is very good. It's a combination of Tinospora cardifolia and this ginger and cumin. Initially it will help. So liver functioning most important thing. And there is one, all of you know about this aloe vera, isn't it? Aloe vera is very good. The pulp could be taken, cut into pieces. Aloe vera juice and ginger juice is quite helpful. So, and the fatty liver could be cut down. So what happens is, slowly fatty liver is there for initial stages. Slowly the liver gets enlarged, and next, once the liver is enlarged, before that only this cholecystitis can occur. So wherein which the gallbladder can be with the gallstones, or there can be a slurry or a sludge or small granules can be there in the gallbladder. So if it obstructs the bile duct, gallbladder neck, it obstructs. So it can cause jaundice, and it can cause pancreatitis. Pancreatitis can in turn cause diabetes. So they should be very careful that fatty liver people, they should follow the diet, and they should take these type of aloe vera and ginger and amrutavalli. What you say it as guduchi, Tinospora cardifolia is much better, and they can take juice of it could be taken. And of course they have to cut down all the fats. That's the most important thing is cutting down fats will really help, and it's good for them.
Yeah. Thank you, doctor.
Thank you. Yeah, thank you.
ನಮಸ್ಕಾರ ಡಾಕ್ಟರ್.
ನಮಸ್ತೆ. Yes.
ತುಂಬಾ ಸಂತೋಷ ಆಯ್ತು, ಸಾಕಷ್ಟು ಇನ್ಫಾರ್ಮೇಶನ್ ಕೊಟ್ಟಿದ್ದೀರಾ ನೀವು. ನನ್ನ ಪ್ರಶ್ನೆ ಬಂದು, ಆಯುರ್ವೇದ ಅಂದ್ರೆ ಇದು ವೇದ ಅಬೌಟ್ ಲೈಫ್, ನಮ್ಮ ಒಂದು ಲೈಫಿನ ಬಗ್ಗೆ ಇರ್ತಕ್ಕಂತಹ ಒಂದು ಮೆಡಿಸಿನ್ಸ್. ಸೊ ಅದರ್ ದ್ಯಾನ್ ಹರ್ಬಲ್ ಮೆಡಿಸಿನ್ಸ್, ಬೇರೆ ತರದ ಒಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಕೂಡ ಇದೆ ಆಯುರ್ವೇದದಲ್ಲಿ. ಸೊ ಅದು ಪಂಚಕರ್ಮ ಅಂತ ಆಗ್ಲಿ, ಶಿರೋಧಾರ, ನಶ್ಯ, ಅದನ್ನ ನಾವು ನಮ್ಮ ಒಂದು ಡಯಾಬಿಟಿಸ್ಗೆ ಬಂದಂತವ್ರಿಗೆ ಯಾವ ರೀತಿಯಾಗಿ ಉಪಯೋಗ ಮಾಡ್ಕೋಬಹುದು ಅಂತ, ಅದು ಯಾವ ರೀತಿ ಉಪಯೋಗ ಆಗುತ್ತೆ. ಇನ್ ಕೇಸ್ ನಮ್ಗೆ ಆ ಒಂದು ಕ್ರಿಯೆಗಳು ಇಲ್ಲಿ ಸಿಗದೆ ಇದ್ದಾಗ, ಟ್ರೀಟ್ಮೆಂಟ್ ಇಲ್ಲಿ ಸಿಗದೆ ಇದ್ದಾಗ, ಅದಕ್ಕೆ ಸಬ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಗಿ ಏನಾದ್ರು ಇದೆನಾ?
ಇವಾಗ ನಾವು ಆಯುರ್ವೇದದಲ್ಲಿ ನಾವು ಏನ್ ಹೇಳ್ತೀವಿ ಅಂದ್ರೆ, ಬರೀ ಇವಾಗ ಪಥ್ಯ ಅಂದ್ರೆ ಆಯುರ್ವೇದ, ಪಥ್ಯ ಅಂದ್ರೆ ಔಷಧಿ ಆತರ ಅಲ್ಲ. ಆಯುರ್ವೇದದಲ್ಲಿ ಆಕ್ಚುಲಿ 8 ಬ್ರಾಂಚಸ್ ಇದೆ ಅಲ್ಲ, ಕಾಯ, ಬಾಲ, ಗೃಹೋರ್ಧ್ವಾಂಗ, ಶಲ್ಯ, ದ್ರಂಷ್ಟ, ಜರ, ವೃಷಾನ್. ಸೊ ಪಂಚಕರ್ಮ is also one of the important branch, I can say, branch of ಕಾಯ ಚಿಕಿತ್ಸಾ. ದೇರ್ ಡಿಟಾಕ್ಸ್ ಥೆರಪಿ ಅಂತ ನಾವು ಹೇಳ್ತೀವಿ. ಡಿಟಾಕ್ಸ್ ಥೆರಪಿನಲ್ಲಿ ಏನ್ ಮಾಡ್ತೀವಿ ಅಂತಂದ್ರೆ, ಅಫ್ಕೋರ್ಸ್ ನಸ್ಯ ಇಸ್ ದೇರ್, ಟ್ರಾನ್ಸ್ ನೀಸಲ್ ಮೆಡಿಕೇಶನ್ ಅಂತ ಇದೆ. ದೆನ್ ವಮನ ಇಸ್ ದೇರ್, ವಾಮಿಟಿಂಗ್ ಥೆರಪಿಟಿಕ್ ಎಮಿಸಿಸ್ ಅಂತ. ದೆನ್ ದರ್ ಇಸ್ ಪರ್ಗೇಷನ್, ಥೆರಪಿಟಿಕ್ ಪರ್ಗೇಷನ್ ಇಸ್ ದೇರ್. Then enema therapy is there, asapana, anuvasana, all that. But could it be followed here in US? It is very difficult because of the stringent rules. So, and here what we can do is, which is easily modifiable detox therapy could be done here. And apart from that, anya karmas, what we say, for example, diabetes, there is peripheral neuropathy, there is burning sensation of the foot. ಹೇಳ್ತಾರೆ ಅಂಗಾಲ್ ಕೈಯೆಲ್ಲ ಉರಿಯುತ್ತೆ, ಕಾಲು ಉರಿಯುತ್ತೆ. ಮೊಮೆಂಟ್ ದ ಪೇಷಂಟ್ ಎನಿಬಡಿ ಸೇಸ್ ದಟ್ ನಿಮ್ಮ ಫ್ರೆಂಡೇ ಇರಲಿ, ಯಾರೇ ಇರಲಿ, ಕೈ ಕಾಲು ಉರಿತಿದೆ ಅಂತಂದ್ರೆ, ಪ್ಲೀಸ್ ಸಜೆಸ್ಟ್ ದಮ್, ಚೆಕ್ ಯುವರ್ ಬ್ಲಡ್ ಶುಗರ್, ವಾಟ್ ಈಸ್ ಇಟ್, ಎವ್ಯಾಲ್ಯೂಯೇಟ್ ಇಟ್ ಅಂತ ಹೇಳಿ. ದಟ್ ಈಸ್ ವೆರಿ ಮಚ್ ಇಂಪಾರ್ಟೆಂಟ್. ಇಫ್ ದೇ ಸೇ ದಟ್ ಬರ್ನಿಂಗ್ ಸೆನ್ಸೇಷನ್ ಇನ್ ದ ಫುಟ್ ಈಸ್ ದೇರ್, ದೇ ಆರ್ ಫೀಲ್ ವೆರಿ ಮಚ್ ಟಯರ್ಡ್, ಅಂಡ್ ದೇ ಗಾಟ್ ಸಮ್ ಸ್ಕಿನ್ ಇನ್ಫೆಕ್ಷನ್, ದಟ್ ಇಸ್ ನಾಟ್ ಗೋಯಿಂಗ್ ಆನ್ ವೆಲ್, ಅಂಡ್ back part of the neck, there is some striations are there, and some infection is not, UTI is not at all relieved. So whatever the medication they take, so medicine they'll be giving for UTI, they'll not be treating diabetes, the most important thing. So this anya karma nali, So padabhyanga could be done. So padabhyanganali, the simple medicated oils are there. There are many medicated oils are there. Madhyashti taila ant helteve. So that could be massage for the foot. Padabhyanga ant helteve. That is foot massage could be done for the peripheral neuritis. So what we can do here is the symptomatic management of the diabetes mellitus could be carried out. So detox therapy could be done also, but enema ella ಹೇಳ್ತಾರೆ. But of course madhu tailaka basti ella ಇದೆ. But here I don't know how far the rules allow to have this medicated basti and all. But karmas could be followed, nothing will be happen. And if there is joint pain, lapas could be done. Some of the medicated drugs are there, you can apply that, and it's a special preparations we get it, so that could be followed. And of course in diabetes, what happens is most of the symptoms, they say that they feel very much lethargic, and for that medicines could be given, and they feel very much tired. So at that time rasayana therapy is the most important thing, rejuvenators. So there are certain drugs which are both anti-diabetic, madhumehara, and they are rasayana also. So for that example, amalaki ಎಷ್ಟು ಹೇಳ್ತಾರೆ ಅಂದ್ರೆ, amalaki bija, it is very good in leukorrhea. A study has been carried out in our department only. And amalaki pulp powder is good in acid peptic diseases, that is amlapittanalli ಚೆನ್ನಾಗಿ ಕೆಲಸ ಮಾಡುತ್ತೆ, that is hyperacidity ನಲ್ಲಿ. At the same time amalaki is very good in diabetes also, madhumehan also. So that is a beauty of Ayurveda. One drug could be used in different forms, different diseases, depending on the dosage form and the duration. How much dose you are giving, what is the form you are giving, either you give it in the form of decoction you give, or the tablet you give, or lehya you give, or linctus you give, and so on. And the duration, how long you want to give, how long you will be giving. So these are the three aspects you have to consider, then only you can administer. And please consult a doctor, anybody, before going for a detox therapy. That's the most important thing.
Sure.
Yeah.
ಆಯುರ್ವೇದ ಅಂತಕ್ಕಂಥದ್ದು ನಮ್ಮ ಅಲೋಪತಿ ಕಂಪೇರ್ ಮಾಡಿದಾಗ ಆಲ್ಮೋಸ್ಟ್ ಥೌಸಂಡ್ಸ್ ಆಫ್ ಇಯರ್ ಹಳೇದು.
3000 years BC.
ಇಂಡಿಯಾದಲ್ಲಿ ಅಥವಾ ಇಲ್ಲಿ ಕೂಡ ನಮಗೆ ಆಯುರ್ವೇದ ಇನ್ಶೂರೆನ್ಸ್ ಕವರ್ ಆಗಲ್ಲ. ಅದಕ್ಕೆ ಆ ಒಂದು ಉದ್ದೇಶಕ್ಕೆ ನಾವು ಸ್ವಲ್ಪ ಹೋಗ್ಬೇಕಾದ್ರೆ ಕೂಡ ಹಿಂದೆ ಮುಂದೆ ವಿಚಾರ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ. ಅಲೋಪತಿ ಕವರ್ ಆದ್ಮೇಲೆ 200 years ಹಿಸ್ಟ್ರಿ ಇರ್ತಕ್ಕಂಥ, ಇತಿಹಾಸ ಇರ್ತಕ್ಕಂಥ ಅಲೋಪತಿ ಕವರ್ ಆದ್ರೆ ಆಯುರ್ವೇದ ಯಾಕೆ ಕವರ್ ಆಗ್ತಾ ಇಲ್ಲ ಅಂತ ಹೇಳಿ ಇಂಡಿಯಾದಲ್ಲಿ ಕೂಡ ಸಾಕಷ್ಟು ಒಂದು ಚಳುವಳಿ ನಡೀತಾ ಇದೆ ಅಂತ ಹೇಳ್ತಾರೆ. ಹೋಪ್ ವಿ ಕುಡ್
ಈಗ ಇಂಡಿಯಾನಲ್ಲಿ ಸ್ವಲ್ಪ ಆಯುರ್ವೇದಿಕ್ ಕವರ್ ಆಗ್ತಾ ಇದೆ ಇವಾಗ. CGHS ಎಲ್ಲ ಸೆಂಟ್ರಲ್ ಗವರ್ಮೆಂಟ್ ಎಲ್ಲ ದೇ ಕವರಿಂಗ್ ದ ಆಯುರ್ವೇದಿಕ್ ಪಾರ್ಟ್. But here, okay, don't worry about that insurance cover here.
No, that's hope where get that.
ಇಲ್ಲಿ ಏನ್ ಮಾಡಿ ಅಂತಂದ್ರೆ, ಈ ಡ್ರಗ್ಸ್ ಮನೆ ಮದ್ದು ಇದೆಯಲ್ಲ ನಿಮ್ಮಲ್ಲಿ, ಕಿಚನ್ ಅಲ್ಲಿ ಚಕ್ಕೆ, ಲವಂಗ, ಶುಂಠಿ, ಬೆಳ್ಳುಳ್ಳಿ ಸಿಗುತ್ತೆ, ಆಮೇಲೆ ಸಾಸಿವೆ ಇರುತ್ತೆ, ಸಾಸಿವೆಯಲ್ಲಿ ಯೂಸ್ ಅದನ್ನ ತಿಳ್ಕೊಂಡ್ರೆ ಸಾಕಷ್ಟೇ ಸಾಕು. ಗುಡುಚಿಯಲ್ಲಿ ಯೂಸ್ ಮಾಡ್ಬೋದು, ಐ ಮೀನ್ ಅಲೋವೆರಾ ಈಸ್ ಈಸಿಲಿ ಅವೈಲೇಬಲ್, ಅಂಡ್ ಚಕ್ಕೆ ಲವಂಗ ಸಿಗುತ್ತೆ, ಆಮೇಲೆ ಮರೀಚ, ಮೆಣಸಿದೆ, ಹಿಪ್ಲಿ ಇದೆ, ಅದರಲ್ಲೇ ತಗೊಂಡು ಯೂಸ್ ಮಾಡ್ಬೋದು ನೀವು. ಅದರಲ್ಲೇ ನಾವು ಆಹಾರವಾಗಿ ಯಾವ ತರ ಯೂಸ್ ಮಾಡ್ಬೋದು, ಔಷಧವಾಗಿ ಯೂಸ್ ಮಾಡ್ಬೋದು. ಅಂಡ್ ಏನಂದ್ರೆ ಫುಡ್ ಬಿ ದ ಮೆಡಿಸಿನ್, ಆ ಮೆಡಿಸಿನ್ ಶುಡ್ ನಾಟ್ ಬಿ ದ ಫುಡ್. That is my idea. Don't be a pill pusher. When you take more medicines, you just think of it. Is it feasible to take? Is it okay to take? Enagate. And you don't think all Ayurvedic drugs are very safe. So when given for a long time, it can also show some adverse drug reaction. So please consult a doctor. It tagoboda anta kelidre aaytu ashte. As a food you take, nothing will happen. As a medicine you take, you have to be little careful and vigilant. Yeah.
Thank you very much. Thank you for consulting. Thank you.
Yeah, ಒಂದು ಮಾತು ಹೇಳ್ಬಿಡ್ತೀನಿ. ಈ ಕನ್ನಡ ಕೂಟಕ್ಕೆ ನಮ್ಗೊಂದು ಅವಕಾಶ ಕೊಟ್ಟಿದ್ದಾರೆ ಮಾತಾಡಿ ಅಂತ. ಧನ್ಯವಾದಗಳು ಇವರು ಪ್ರಸಾದ್ ಅವರಿಗೆ, ಹಾಗೂ ಡಾಕ್ಟರ್ ಭಾರತಿ ಅವರಿಗೆ ಧನ್ಯವಾದಗಳು, ಎಲ್ಲ ಗೀತಾ ನಾಗೇಶ್ ಅವರಿಗೆ, ಎಲ್ಲರಿಗೂ ಧನ್ಯವಾದಗಳು. ಇದೊಂದು ಎಲ್ಲರಿಗೂ ಒಂದು ಉಪಯೋಗ ಆಗ್ಬೋದು ಅಂತ ಅನ್ಕೊಳ್ತೀನಿ. ಎಷ್ಟರ ಮಟ್ಟಿಗೆ ಆಗತ್ತೆ ಅಂತ ಹೇಳಿ ನೋಡೋಣ. Thank you one and all for patient listening, and you are with me for a long time. Maybe it is 1.5, yeah, maybe 1 hour 15 minutes or so. Yeah,
almost ಇದೆ. But before we conclude, madam, nandan question ಇದೆ, if you don't
sure, why not? I will be very happy. Yes, tell me.
Yes, I mean, one the challenge, Andre, probably you covered, a lot of information. I think that very nice, madam. And actually, not just the diabetes ಬಗ್ಗೆ, but home mane maddu, that is a easily accessible medicines at home. So that is the one, and also ಇಂಟಿಗ್ರೇಟಿಂಗ್ ಇವಾಗ ಮೋಸ್ಟ್ ಆಫ್ ದಮ್ ಹೇಳ್ದಂಗೆ ಆಯುರ್ವೇದ ನಿಧಾನ ಅಲ್ಲ, ಬಟ್ ನಾವು ನಿಧಾನಕ್ಕೆ ಆಯುರ್ವೇದಕ್ಕೆ ಹೋದ್ರೆ ಆವಾಗ ಪ್ರಾಬ್ಲಮ್ ಶುರು ಆಗೋದು. ಐ ಮೀನ್ ಟೇಕ್ಸ್ ಟೈಮ್. ಸೊ ಹಾಗಾಗಿ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ಆಯುರ್ವೇದ ಡಾಕ್ಟರ್ ಹತ್ರ ಬರೋ ಅಷ್ಟೊತ್ತಿಗೆ ದೇವ್ ಆಲ್ರೆಡಿ ಬಿನ್ ಇನ್ ಅ ಕ್ರಾನಿಕ್ ಫೇಸ್, ಲೈಕ್ ಮೇ ಬಿ 2 years ಆಗಿರುತ್ತೆ, ಮತ್ತೆ ಕಾಂಪ್ಲಿಕೇಶನ್ ಶುರು ಆಗಿರುತ್ತೆ. ಸೊ ನನ್ನ ಪ್ರಶ್ನೆ ಏನಂದ್ರೆ, ಸೊ ಇವಾಗ ಆಲ್ರೆಡಿ ಮೆಡಿಕೇಶನ್ಸ್ ತಗೊಳ್ತಿರ್ತಾರೆ, ಟೈಪ್ 1 ಇನ್ಸುಲಿನ್ ಬೇಸ್ ಇರ್ಬೋದು, ಅಥವಾ ಟೈಪ್ 2 ಡಯಾಬಿಟಿಸ್ ಇರ್ಬೋದು. ಸೊ ಅವರು ಆಯುರ್ವೇದಿಕ್ ಅವ್ರ ಮೆಡಿಸಿನ್ಸ್ ತಗೊಳ್ತಾ ಇರ್ತಾರೆ. ಅವರು ಆಯುರ್ವೇದ ಶುರು ಮಾಡ್ಬೇಕಂದ್ರೆ ವಾಟ್ ಆರ್ ದ ಪ್ರಿಕಾಷನ್ಸ್ ದೇ ಶುಡ್ ಟೇಕ್? ಬಿಕಾಸ್ ಯು ಕ್ಯಾನ್, ಆಸ್ ಯು ಸೆಡ್, ಆಯುರ್ವೇದ ಇಸ್ ನಾಟ್ ಆಲ್ ದ herbs are not completely safe. You have to take with some precaution and with some supervision. So what is your thoughts or advice for someone who's already on medications, and when they have to integrate Ayurvedic herbs? Of course, when the Ayurvedic practitioner prakara hodaga, they will probably have some proper guidance. But avre ivaga mane maddaagli ಅಥವಾ ಒಂದು over the counter sigo ashwagandha start ಮಾಡಿದಾಗ what care should they take anta?
Yeah, what is my advice is, if there are allopathic drugs, so don't let them not take however they want. Let them not take guduchi or amalaki, that is a gooseberry tablet, whatever it may be. Let them not take. Let them consult a doctor and take. As a food, if they take, if they are found to be diabetic, okay, they want to take avla powder. If they want to make avla chutney, gooseberry chutney, no problem. As a food, it goes there.
As a food.
But if they want to take tablet, if 1000 mg of avla goes into the body for a long time, it can cause ADR. As a food, there is no problem with these herbs. But as a medication, if they are taking, they have to be a little careful. They have to consult a doctor. So OTCly, it may be available. For example, phenytoin is given for epilepsy, isn't it? They give epileptic attacks. They give, and the patient only saw that, okay, Shankapushpi is very good for memory epilepsy. He started taking that. But it reduced the action of phenytoin also. It did not act at all. In spite of taking this phenytoin and Shankapushpi, the patient got seizures. What do you say about this? This has lowered the efficacy, isn't it? So they have to be careful. And there are many papers on that. For example, we had a pharmacovigilance unit before. I have it. There, for example, Haritaki, Terminalia cebula is very good drug for skin disorders, and is a very good nootropic, very good memory enhancer. And research work has been done, absolutely. But if you start taking Haritaki for a long time, they say that it's not good. It aggravates Vata. They can land up with many problems, joint pain and all. For example, for that matter of factor, a hypertensive patient, long time ago, maybe 8 years back, they were taking Ayurvedic doctor himself. They were taking Sarpagandha to reduce hypertension. Then, for a long time, especially Sarpagandha tablets they were taking. So it was good. It has been taken for a long time. Then one fine day, they landed up with a ptosis, drooping of the eyelids. It has resulted in Vatavedi, neurological problem. So in diabetic, any problem, I say that, any problem, if the drugs are taken, for example, cumin, ginger, garlic, etc., if it is taken as a food, there is no problem. It goes in a small quantity. As a medication or a drug, it can cause ADR. For example, garlic in DUB patients, if you start giving for a long time, for example, garlic is given for every day, the patients start consuming as a medicated thing for joint pain, especially in dysfunctional uterine bleeding. It causes it aggravates naturally, isn't it? So garlic how much to be taken for joint pain? And garlic is also a very good blood thinner and anticoagulant. In cardiac patients, a lady who's got hypertension, she'll be taking. For 1 month, she takes as a garlic capsules there is available, soft gel capsules are there. If she starts taking, what happens? So that cause dysfunctional uterine bleeding. Like this, we have a list of medicines which are given ADR, adverse drug reaction. We recorded quite a lot of cases. So our duty was to every month to record the ADRs only, adverse drug reaction. Go to each department, any ADR have you found? That we are done.
Yeah.
That's another thing. Yeah.
So you have to be careful when you're introducing herbs. ಒಂದು ಟರ್ಮರಿಕ್ ನೀವು ಹೇಳ್ದಂಗೆ ಟರ್ಮರಿಕ್ ನ ನಾವು ಕುಕಿಂಗ್ ಅಲ್ಲಿ ಯೂಸ್ ಮಾಡಕ್ಕೂ ಟರ್ಮರಿಕ್ ನ ನಾವು ಕ್ಯಾಪ್ಸೂಲ್ಸ್ ಅಲ್ಲಿ ಎಕ್ಸ್ಟ್ರಾಕ್ಟ್ ಯೂಸ್ ಮಾಡಕ್ಕೂ ಹ್ಯೂಜ್ ಡಿಫರೆನ್ಸ್ ಇದೆ. Yeah. So you have to be cautious.
Yeah. Again, from Draviguna point of view, you have to know that is the drug aqueous extract, alcoholic extract. Nowadays, what is happening is they are giving the drug in alcoholic extraction also, benzene, ether, and all the marketing. That's not good. Aqueous extract only, is it efficacious? So even that has to be thought. In the capsule, how much of Haridra Churna is there as aqueous extract? So solubility of the drug also is most important thing which we have to think of. Haridra, sometimes what happens, it causes itching when it is applied. So curcumin can be, sometimes for some people it is not good. There the prakriti has to be analyzed. So many things are there. So as a food there is no problem. As a drug, they have to be little careful.
Yeah. Thank you very much, ma'am. That was really very insightful information.
Finally, I say that don't be idle to lead an ideal life. You should not be idle to lead an ideal life. And as a patient, as a doctor, everybody. Yeah.
ನಮಸ್ಕಾರ, ಧನ್ಯವಾದಗಳು ಡಾಕ್ಟರ್ ಲಲಿತಾ ಅವರೇ. ಇದುವರೆಗೆ ನಮ್ಮ ಸದಸ್ಯರಿಗೆಲ್ಲ ಒಳ್ಳೆ ಮಾಹಿತಿ ಹೇಳಿದ್ದೀರಾ. ಸೊ ಇದರಿಂದ ಡಯಾಬಿಟಿಸ್ ಕಂಟ್ರೋಲ್ ಮಾಡೋದು, ಮಧುಮೇಹನ ಹತೋಟಿಲಿ ಇಡುವಂಥ ಹಲವಾರು ಉಪಾಯಗಳನ್ನು ಹೇಳ್ಕೊಟ್ಟಿದ್ದೀರಾ. ನಮ್ಮ ಸದಸ್ಯರಿಗೆಲ್ಲ ಉಪಯೋಗ ಆಗುತ್ತೆ ಅನ್ಕೊಳ್ತೀನಿ. ಅಷ್ಟೊತ್ತು ಮಾತಾಡಿದ್ದಕ್ಕೆ, ನಮಗೆಲ್ಲ ಈ ಮಾಹಿತಿ ನೀಡಿದ್ದಕ್ಕೆ ಕರ್ನಾಟಕ ಸಾಂಸ್ಕೃತಿಕ ಸಂಘದ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕವಾದ ಧನ್ಯವಾದಗಳು. ಮತ್ತೆ ಪ್ಯಾನಲಿಸ್ಟ್ ಆಗಿ ಬಂದಿರತಕ್ಕಂಥ ಧಾರಣಿ ದೀಕ್ಷಿತ್, ಮಂಜುನಾಥ್ ಶರ್ಮಾ, ಗೀತಾ ಮತ್ತು ನಾಗೇಶ್ ದಂಪತಿಗಳು ಮತ್ತೆ ಭಾರತಿ ಅವರೇನಿವೆ, ಅವರೆಲ್ಲರಿಗೂ ಹೃತ್ಪೂರ್ವಕವಾದ ಧನ್ಯವಾದಗಳು. ಮತ್ತೆ ನಮ್ಮ ಕಾರ್ಯಕ್ರಮ ನೋಡ್ತಿರ್ತಕ್ಕಂಥ ನಮ್ಮ ಎಲ್ಲ ಸದಸ್ಯರು, ಸ್ನೇಹಿತರಿಗೂ ಕೂಡ ಧನ್ಯವಾದಗಳು. ಮತ್ತೊಮ್ಮೆ ಮುಂದಿನ ನಿಮ್ಮಲ್ಲಿಗೆ ಕನ್ನಡ ಕಾಟ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಭೇಟಿಯಾಗೋಣ. ಅಲ್ಲಿವರೆಗೆ ನಮಸ್ಕಾರ, ಶುಭರಾತ್ರಿ.
ಧನ್ಯವಾದಗಳು ಎಲ್ಲರಿಗೂ.